The pectoral region forms the front of the chest. It contains of muscles and parts that help in the movement of the arm. But first, let's look at the surface anatomy of the pectoral region. At the middle of the pectoral region, right above the sternum, lies a notch which is highly palpable. And this notch is called the jugular notch. It is also called the suprasternal notch because the notch lies above the sternum. If you move your fingers to either side of the notch, you can feel a horizontally lying bone. And this bone is called the clavicle, which is present on either side of the notch. The clavicle has two ends, the medial end, which is connected to the sternum, and the lateral end, which is connected to the medial end of the clavicle articulates with the manubrium sterni of the sternum at the sternoclavicular joint with the help of sternoclavicular ligament, and the lateral end of the clavicle articulates with the acromion process of the scapula at the acromioclavicular joint with the help of acromioclavicular ligament. This is the jugular notch. It is present between the two clavicles, so it is also called the interclavicular notch. It is present right above the manubrium sterni of the sternum, so it is also called the suprasternal notch. About 5 centimeter below this notch, you can feel a slight elevation, and this is nothing but the sternal angle, which is also called the angle of Louis. But the question is, what exactly is sternal angle or the angle of Louis? So as you know, the sternum contains three major parts. It contains the manubrium. This is the manubrium sterni. It contains the body. This is the body of the sternum. And finally, it contains the xiphoid process. Between the manubrium sterni and the body of the sternum lies the sternal angle. This sternal angle can be felt or palpated about 5 centimeter below the jugular notch. And this sternal angle, which is palpated in the form of a slight elevation, marks the position of the second rib. So as you can see in this picture right here, here's the sternal angle, and at the two sides, here's the second rib. So this is the second rib, and from second rib onward, you can palpate the rest of the ribs present downward. So second rib, third rib, fourth rib, and so on. At the bottom of the sternum lies the xiphoid process within the infrasternal angle, which I'll show you with the help of a diagram, so no worries. So within the infrasternal angle, there's your xiphoid process, and in front of the xiphoid process is a fossa, which can be palpated with the help of your fingers. So here's a fossa. This fossa is called the epigastric fossa. So here's the sternum. At the bottom of the sternum is present the xiphoid process, which is present within the infrasternal angle, which is an angle at the bottom of the sternum. In front of the xiphoid process and in between the infrasternal angle lies the epigastric fossa. So there's a line that passes through the middle of the sternum, which is called the mid-sternal line. And then there's a line that passes through the midpoint of the clavicle and the tip of the ninth costal cartilage, called the mid-clavicular line. Right below the junction of the medial and the lateral part of the clavicle lies the infraclavicular fossa. The infraclavicular fossa is also called the deltopectoral triangle because it is bound by deltoid muscle from one side and pectoralis major muscle from another side. This much is the palpable region of the deltopectoral triangle, and this much is the anatomical region of the deltopectoral triangle. Anatomically, the triangle contains three boundaries: the medial boundary, the lateral boundary, and the superior boundary. the three boundary are surrounded by three different parts. So let's look at the borders of the deltopectoral triangle. Medially, it is bound by the pectoralis major muscle. Laterally, it is bound by the anterior fibers of the deltoid muscle. And superiorly, it is bound by the clavicle. As you can see in this cadaver, the deltopectoral triangle is present right here, which is also called the deltopectoral fossa. Now, the deltopectoral fossa is bound by three different structures from three different borders, and they are: the medial border is bound by the clavicular fibers of pectoralis major muscle. The lateral border is bound by the clavicular fibers of the deltoid muscle. And superiorly, the superior border is bound by the clavicle itself. This blue vessel is the cephalic vein, which carries deoxygenated blood from the arm. Under pectoral region, we are going to study different muscles. Individually, we are going to look at the origin, insertion, and the function of each of these muscles. Let's start with the first muscle. This huge muscle right here is the pectoralis major muscle, which is one of the largest muscle of the pectoral region. It has fibers arising from four different regions. Let's look at each of them. So pectoralis major muscle has fibers arising from the anterior surface of the medial part of the clavicle, and these fibers are called the clavicular fibers. It has fibers arising from the manubrium called the manubrial fibers. It has fibers arising from the sternum as well as the costal cartilage. Which costal cartilage? Second, third, fourth, fifth, and sixth costal cartilage, forming the sternocostal fibers. And finally, it has fibers arising from the aponeurosis of external oblique muscle called the aponeurotic fibers. What is aponeurosis? Aponeurosis is nothing but a flat tendon. And what is external oblique muscle? It is the muscle that is present obliquely right here. So what do we have in the middle? We have the abs, the abdi. And laterally present obliquely are the external oblique muscles. This right here is the aponeurosis of the external oblique muscle, and from there arises the aponeurotic fibers of your pectoralis major muscle. If you isolate the pectoralis major muscle, it looks something like this. So it has fibers arising from the clavicle called the clavicular fibers. It has fibers arising from the manubrium called the manubrial fibers. It has fibers arising from the sternum as well as the costal cartilage. Which costal cartilage? Second, third, fourth, fifth, and sixth costal cartilage called the sternocostal fibers. And it has fibers arising from the aponeurosis of external oblique muscle called the aponeurotic fibers. 1, 2, 3, 4. Clavicular fibers, manubrial fibers, sternocostal fibers, and aponeurotic fibers. Now let's look at the origin and insertion of pectoralis major muscle. The pectoralis major muscle originates from the anterior surface of the medial part of the clavicle, from the anterior surface of manubrium, from anterior surface of sternum, from second, third, fourth, fifth, and sixth costal cartilage, as well as the aponeurosis of external oblique muscle. All the fibers arising from all these different origins finally insert here. This is the insertion. This bone is the humerus. This is the bicipital groove of the humerus. And here's the lateral lip of the bicipital groove. So the insertion of pectoralis major muscle is the lateral lip of the bicipital groove of humerus. The pectoralis major inserts with the help of a bilaminar tendon. Pectoralis major muscle allows us to do various types of actions like shoulder transverse adduction, shoulder flexion, shoulder adduction, shoulder depression, medial rotation. The next muscle on the list is hidden behind the pectoralis major muscle, and it is the pectoralis minor muscle. This muscle right here is the pectoralis minor muscle. It originates from near the junction between the cartilage and bony part of the rib, which is the costochondral junction. So near the costochondral junction is the origin for the pectoralis minor muscle. So it's from third, fourth, and fifth rib. The pectoralis minor muscle inserts into the coracoid process of scapula. Upon isolation, the muscle looks like this. So here's the pectoralis minor muscle. The pectoralis minor muscle originates usually from third, fourth, and fifth rib, even though that's not what has been shown in this picture. But the reality is that it originates from third, fourth, and fifth rib, where near the costochondral junction, near the costochondral junction, near the costochondral junction, and it inserts into the coracoid process. Which part of coracoid process? So the medial part, but the upper surface of the medial part. So here's the coracoid process. This is the medial part of the coracoid process, and here's the upper surface of the medial part of the coracoid process. This is where the pectoralis minor muscle inserts, while it originates from third, fourth, and fifth rib. The pectoralis minor muscle helps in protraction of scapula like during a push-up. Next up, we have subclavius muscle. As the name suggests, the subclavius muscle is present right below the clavicle. Upon isolation, the muscle looks something like this. It is present right below the clavicle. The origin of the subclavius muscle is at the first rib. Which part of the first rib? The costochondral junction of the first rib. And the muscle itself inserts on the inferior surface of the clavicle. On the inferior surface of the clavicle, within the middle one third of the clavicle, there's a groove called the subclavian groove. The subclavius inserts in the subclavian groove. So there's your subclavius muscle. The origin is the costochondral junction of the first rib, and the insertion is the subclavius groove. The subclavius is a stabilizing muscle. That is, it steadies the movement associated with shoulder. So while moving your shoulder, the act of stabilizing the various movements is done by the subclavius muscle. The platysma, the muscle which has been highlighted in the diagram, is a subcutaneous muscle. That is, it is present right beneath the skin. Beneath the skin, at the pectoral region, is the superficial fascia, and platysma muscle forms a part of superficial fascia. What is superficial fascia? That you'll come to know when you study the different layers of pectoral region. Let's isolate this muscle. Upon isolation, the muscle looks like this. So here's the platysma muscle. The platysma muscle originates at the deep fascia. Deep fascia is present below superficial fascia, and it covers the pectoralis major muscle. The platysma muscle inserts at the base of the mandible, and few of its fibers go back and insert at the lower part of the skin of face. So the origin is the deep fascia, and the insertion is the base of the mandible as well as the base of the facial skin. When the angle of the mouth is pulled down, the muscle contracts and wrinkles the skin of the neck. Let's look at the various layers of the pectoral region. So outermost there is obviously the skin. After you peel off the skin, under the skin, you are going to find the superficial fascia. Fascia is nothing but a sheath of fibrous connective tissue. Below superficial fascia is the deep fascia, which is also called the pectoral fascia because it covers the pectoralis major muscle. So obviously, if you remove the deep fascia or if you peel off the deep fascia, you are going to get the pectoralis major muscle. Below pectoralis or behind pectoralis major muscle is the clavipectoral fascia. Clavipectoral because this fascia covers or surrounds pectoralis minor muscle and subclavius muscle. So after you peel off the clavipectoral fascia, you are going to get pectoralis minor and subclavius muscle. So what did I say? Outermost layer is the skin. Okay, so outermost layer is the skin, which contains epidermis and dermis. Right below the skin is the superficial fascia, which contains breast, cutaneous nerves, cutaneous blood vessels, and platysma muscle. Below superficial fascia is the deep fascia. The deep fascia covers the pectoralis major muscle. So the muscle present right behind the deep fascia is the pectoralis major muscle. Behind pectoralis major muscle is the clavipectoral fascia. The clavipectoral fascia. The clavipectoral fascia wraps two muscles. They are the pectoralis minor muscle and the subclavius muscle. So number 1 is the skin, number 2 is superficial fascia, number 3 is deep fascia, number 4 is pectoralis major muscle, number 5 is clavipectoral fascia, and number 6 are the muscles which are wrapped by clavipectoral fascia or pectoralis minor and subclavius muscle. Let me show the same thing with the help of a better diagram. So this right here is the side view. This is a side view. It contains the breast as well. So this is the pectoral side view of the pectoral region. Outermost, you can see the outermost layer contains epidermis and dermis, which is obviously the skin. Once you peel off the skin, the layer that you get beneath the skin, which is represented with the help of blue color here, is the superficial fascia. This superficial fascia of the pectoral region contains the breast. Below the superficial fascia, so here's the superficial fascia in blue. Below the superficial fascia, there's the deep fascia, which is also called the pectoral fascia. Why? Because it covers the pectoralis major muscle. Okay. Let me show you another diagram. This is also the side view of pectoral region. However, this is the front and this is the back. Right behind the pectoralis major muscle, there's the clavipectoral fascia. The clavipectoral fascia. This clavipectoral fascia, it wraps a muscle here and then it wraps a muscle here and then goes and it extends and it joins the axillary fascia. The muscle that it wraps right here is the pectoralis minor muscle, and the muscle it wraps right here is the subclavius muscle. So we are going to look at each of these layers individually. So the first layer was the skin. The second layer is the superficial fascia. Superficial fascia. The third layer is the deep fascia. or the pectoral fascia. The fourth layer contains the pectoralis major muscle, the pectoralis major muscle. The fifth layer contains the clavipectoral fascia, the clavipectoral fascia. The clavipectoral fascia wraps pectoralis minor muscle, and subclavius muscle. We are already done with the various types of muscles. So what we are going to look at in detail are the fascia, or the superficial fascia, the deep fascia, and the clavipectoral fascia. Let's start with the superficial fascia. So right below the skin is the superficial fascia. This you see right here is all superficial fascia which is covering the pectoral region. The superficial fascia contains four major parts. First are the cutaneous nerves. Cutaneous nerves are the cutaneous branches of the spinal nerves that are supplied to the pectoral region. Which part of the pectoral region? The superficial fascia of the pectoral region. It contains cutaneous vessels, blood vessels supplied to superficial fascia. It contains platysma muscle. We have already dealt with it. And finally, it contains breast as well. First, let's look at subcutaneous nerves. This is the spinal cord. From the spinal cord arises spinal nerves. C1, C2, C3, C4, C5, C6, dot 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 dot. All these are spinal nerves named after where it branches from, which region it branches from, or which vertebra it branches from. C1 to C5 nerves or spinal nerves form a meshwork, and a meshwork of nerves is what we call a plexus. Since this plexus contains spinal nerves of the cervical region, it's called the cervical plexus. C6 to T1 also forms a plexus called brachial plexus. You don't need that in detail for this particular lecture, but what you need to know is this much. So this is the spinal cord. From either side of the spinal cord arises spinal nerves. There are altogether 31 pairs of spinal nerves, 31 on this side and 31 on this side. These spinal nerves, they are supplied to various parts of the body. Few of these spinal nerves also form branches that supply to the skin or the superficial region, the skin. And these are nothing but the cutaneous branches. So it is, or these are the branches that supply or that are supplied to the superficial fascia. Let's look at the cutaneous branches or the cutaneous nerves supplying the superficial fascia or the skin of the pectoral region. Right. Okay. So here's the sternal angle. It is the point where the manubrium articulates with the main body of the sternum. Above the sternal angle, the cutaneous nerve is different, and below the sternal angle, the cutaneous nerve is different, supplying the pectoral region. So first, let's talk about the cutaneous nerve above the sternal angle. Among the spinal nerves, C3 and C4 spinal nerve, which is a part of cervical plexus, form branches that supply the pectoral region above the sternal angle. Since these cutaneous branches, they arise from above the clavicle, they are also called supraclavicular nerves. There are three of them on each side. 1, 2, 3. These three nerves, they don't just supply to the pectoral region but to the deltoid region as well. It supplies to the pectoral region above the sternal angle and deltoid region as well. The three nerves are named as per their location. So there's your lateral supraclavicular nerve, intermediate
supraclavicular nerve, and medial supraclavicular nerve. Below the sternal angle, the supply of the cutaneous nerve is as follows. So the from T2 till T6 spinal nerves, they give off branches, cutaneous branches, that are supplied to the anterior region of the pectoral region. And these branches are the anterior cutaneous nerves. T2, T3, T4, T5, T6. Similarly, to the lateral side of the pectoral region, lateral cutaneous nerves are supplied from T3 till T6 spinal nerves. T3, this is branch of T3, this is branch of T4, this is branch of T5, and this is the cutaneous branch of T6. So above sternal angle, C3 and C4 spinal nerves, they form the supraclavicular nerves, which are the cutaneous branches supplied to the pectoral region above sternal angle. Below sternal angle, T2 till T6 spinal nerves give off anterior cutaneous branches that supply to the anterior region of the pectoral region, and T3 till T6 give lateral cutaneous branches that supply to the lateral region of the pectoral region. Now here's the thing. Okay, C3 has cutaneous branches, C4 has cutaneous branches, T2 has cutaneous branches, T3 has cutaneous branches, T4 has cutaneous branches, T5 has cutaneous branches, T6 has cutaneous branches. C3 and C4 have cutaneous branches above the sternal angle. T2 till T6 have cutaneous branches below the sternal angle. But what about the spinal knobs between C4 and T2? That is, what about C5, C6, C7, C8, and T1? Do these spinal knobs not have cutaneous branches for the pectoral region? And the answer is yes, they don't. These spinal knobs, they are pulled towards the upper ram. So the spinal knobs from C5 till T1, they supply to the upper ram and not the pectoral region. Let's look at the cutaneous vessels supplying blood to the superficial fascia. Here's the sternum. From the sternum arises ribs. They are present on either side of the sternum, so the same is present on the other side as well. The sternum along with the ribs makes the thorax or the rib cage. Within the rib cage lies the heart. From the heart arises the subclavian artery. The subclavian artery gives rise to an artery which passes through the inside of the thorax, so called the internal thoracic artery. The internal thoracic artery gives rise to branches that perforate through or that penetrate through the intercostal region. So that's why these branches are called the perforating branches. See, here's your heart. The heart gives rise to the aortic arc. From the aortic arc arises the subclavian artery, right? The subclavian artery gives rise to the internal thoracic artery, which is present where? Which is present within the thorax. The internal thoracic artery gives rise to branches that penetrate through the space or the region between the ribs or the intercostal region. So these branches, they penetrate through the intercostal region, and these branches are called perforating branches. Which nerves do perforating branches accompany? Perforating branches, they accompany the anterior cutaneous nerves. So you have anterior cutaneous nerves that are accompanied by perforating branches. Which nerves? See, these nerves, the anterior cutaneous nerves, they are accompanied by perforating branches of the internal thoracic artery, of the subclavian artery, of the aortic arc, of the heart. Okay. So anterior the anterior cutaneous nerves are accompanied by perforating branches that supply blood to the anterior region of the superficial fascia of the pectoral region. Fine. Similarly, the lateral nerves are also accompanied by certain arteries. Okay, so what about the lateral cutaneous nerves? This is the top view. That is, we are looking at a transverse section. Here's the sternum. So this is obviously the front. And here's this vertebra. So this is the back. We are looking at a transverse figure of intercostal region, that is in between the two ribs or two costa. At the back, there's your aorta. The aorta gives rise to an artery that supplies blood in between the two ribs, so called the intercostal artery. Since this intercostal artery is present at the back or the posterior region, it is called the posterior intercostal artery. The posterior intercostal artery gives rise to branches laterally that supplies blood to the cutaneous region. So these are the lateral cutaneous branches. And these lateral cutaneous branches, they accompany the lateral cutaneous nerves. See, this is what I mean. Let's say this is the vertebra, right? From the vertebra arises rib. Here's one rib. Here's the other rib. Similarly, another rib as well. Here's the other rib. Here's the other rib. In between the two ribs is the intercostal region, or between two costa. These this region is supplied with blood vessel from behind arising from the aorta. So here's the aorta. From the aorta arises branches that supply to the region between the two ribs. These branches are intercostal arteries, and since they are present posteriorly, they are the posterior intercostal artery. The posterior intercostal artery give rise to their own branches, right? And these branches, they supply laterally to the cutaneous region by accompanying the lateral cutaneous nerves. So these branches, wait, these branches are the lateral cutaneous branches of the posterior intercostal artery arising from the aorta. Again, here's the aorta. From the aorta arises artery that supplies blood to the intercosta, called the intercostal artery. Since they arise posteriorly, they are the posterior intercostal artery. From the posterior intercostal artery arises branches that supply to the lateral part towards the cutaneous region or the superficial fascia. They are the lateral cutaneous branches, and these lateral cutaneous branches, they accompany, yes, they accompany the lateral cutaneous nerves. So they accompany the branches, they accompany the lateral cutaneous nerves. Right below the superficial fascia lies the deep fascia, which is also called the pectoral fascia because it covers the pectoralis major muscle. The deep fascia superiorly is connected with the clavicle. Anteriorly, it is connected with the sternum. Inferiorly, it continues as the thoracic fascia and the rectus sheath. The rectus sheath covers the abs muscle. All that remains is laterally. Superolaterally, the deep fascia continues with the deltoid fascia, and inferolaterally, the deep fascia continues with the axillary fascia. As you can see in this particular diagram as well, The deep fascia, it continues with the axillary fascia. The deep fascia, it curves and then continues with the axillary fascia. This is the side view.
Right under the pectoralis major muscle is the clavipectoral fascia. This is where the pectoralis major muscle was supposed to be. We removed the pectoralis major muscle. Upon removal of pectoralis major muscle, right below it, we find another fascia. And this fascia is called the clavipectoral fascia. The reason it is called clavipectoral fascia is because it wraps pectoralis minor muscle and it also wraps the subclavius muscle. That's why clavipectoral fascia. As you can see in this particular diagram as well, here's the pectoralis minor muscle in purple and here's the subclavius muscle. Both these muscles are completely wrapped by clavipectoral fascia from both sides, that is from front as well from back. Here's the pectoralis minor muscle, which is wrapped by the fascia from front as well as the back. And here's the subclavius muscle, which is wrapped by the fascia from front as well as the back. The clavipectoral fascia, it starts from the clavicle at top and it extends till the axillary fascia at the bottom or the inferior portion. Let's look at the same fascia by taking a vertical section. Let's say I take a vertical section right here and look at the side view of this vertical section. So this diagram right here is nothing but the side view of the vertical section that is taken right here. That is why you are able to see the structures that fall under this line here, such as the clavicle, which is present here, the subclavius muscle, which is present here, the pectoralis minor muscle, which is present here, the axillary fascia, which is present here. The clavipectoral fascia superiorly splits. This clavipectoral fascia splits and covers the subclavius muscle. The posterior lamina of the clavipectoral fascia that has split continues as the investing layer of deep cervical fascia. The fascia extends and inferiorly it splits again to wrap pectoralis minor muscle from both sides. Then it extends as the suspensory ligament for axillary fascia. The suspensory ligament, it attaches with the dome of the axillary fascia. So let me show the boundaries of the clavipectoral fascia here. Superiorly, it arises from the clavicle. Superiorly, it splits into two lamina to cover the subclavius muscle. The lamina that is present posteriorly, it extends as the investing layer of deep cervical fascia, which is present at the neck region. The fascia continues and splits again inferiorly to cover the pectoralis minor muscle. It then continues to form the suspensory ligament for the axillary fascia. Medially, the clavipectoral fascia, it arises from the FOS2 external intercostal muscle. So here's the first costa or the first rib, here's the second rib, and here's the third rib. This is the first intercostal space, here's the second intercostal space. Here's the external muscle of the first intercostal space. Here's the external muscle of the second intercostal space. The fascia arises from the first two external intercostal muscle. Laterally, the fascia attaches to the coracoid process. So here's the coracoid process. This is where the fascia attaches to. Clavipectoral fascia is pierced by the following structures. They are your vein, artery, nerve, and lymphatics.
So these four structures, they pierce through the fascia. There's your cephalic vein that connects with a much larger vein called the axillary vein. There are thoracoacromial vessels that connect with the subclavian artery. There's lateral pectoral nerve which branch out from the brachial plexus. And finally, there are lymph nodes that pierces through the fascia and reach the axillary lymph nodes.